Welcome to an episode of King's Conversations. Today's episode is all about the invisible nursing workforce, also known as overseas nurses. This episode comes at a very fitting time as the NHS just celebrated its 70th anniversary. We're joined today by Dr. Dilla Davis, an academic speaker here at King's College London, and also a campaigner for change in the nursing and midwifery policies. She's one of the best people to unravel the myths and share her expertise on how we can utilize and empower this nursing workforce. Thank you, Dilla, for joining us.
Thank you, Megan. I'm happy to be here.
So one of the first questions that we have is just how can we recognize and utilize this overseas nursing workforce?
Before we go on to how the UK is recognizing, I think we need to mention the levels of IENs, internationally educated nurses in UK. So predominantly what we see is the international educated nurses being recruited straight into the NHS system.
Okay.
They have to pass a number of loops to get into the nursing and midwifery register, and then they start working in the NHS, and that's fine. Then we have the invisible nursing workforce. These nurses are trained back in their home countries, but they are working in UK as unregistered practitioners. So when I say unregistered practitioners as Band 2, Band 3 or Band 4 in the health and social care setting. So it is this small, not small, we have evidence of more than 3,000 of such nurses working in UK and in a low paid, undervalued kind of a framework. It is this cohort of nurses that the UK has not yet recognized. So the other nurses who are coming in through the normal channels, through the normal recruitment channels, they are being supported by the preceptorship programs, orientations, pastoral care, and you have a number of international nursing and midwifery associations who support this recruitment and newly recruited nurses. However, we turn a blind eye to these particular cohort of nurses.
And with that stratification of international nurses, how does that stratification even start?
The story begins around in 2000 and 2001. At that time, when the international nurses came over to UK, when they were recruited, it was a very simplified process. They came over here, they followed an adaptation course. So in the NHS, there's an adaptation place for them, through which they were supported by a mentor. After 4 to 6 months, they get their NMC PIN number.
And the NMC PIN number,
yes,
what is that?
That is the Nursing and Midwifery Council registration personal identification PIN number, which you need to get to work in the NHS.
Okay, so like that's how their license is recognized in the UK here.
Yes.
Okay, makes sense.
I don't think it's a common term license. We say registration.
Okay,
and the PIN number. Yes, yeah. But then during that period, 2000, 2001, 2003, there was a lack or deficit of adaptation places, funded adaptation places. So nurses were coming in, but they were not getting these adaptation places. So what they did was they paid and went to nursing homes to get that adaptation place and to get their PIN number, and then they came into the NHS to work as a registered nurse. It is called the backdoor policy, but they came into work. Then in 2005 onwards, it was the lucky nurses who came in who got in through the nursing homes, got their PIN number, and came to work in the NHS. Mm-hmm. A large number of nurses still didn't get these adaptation nurses, or they couldn't fund for these adaptation places. They were left in a kind of a limbo. By that time, in 2005, Nursing and Midwifery Council started with an English language test. So any overseas nurse who came over, apart from European nurses, they have to undergo the English language test. They started off with the IELTS, the International English Language Test That's the first one. And they have to pass at a score of 7, level 7. It was extremely hard for many of these nurses. They attempted 13, 14 times these exams, but they didn't get the required 7. They are tested across the 4 domains of English language. They are the speaking, the listening, the writing, the reading. And they have to get 7 across the 4 domains.
Okay.
Then over the years, NMC said not just IELTS, we can have OET language test, that is Occupational English Language Test. Even then, and the required score was B, even across the 4 domains. But even then, these particular nurses found it very difficult, because we have to understand the context, because the question would be, oh, the newly recruited nurses can pass these language tests. Why are these nurses who have been in this country for the past 16, 17 years cannot pass these language tests? Yeah. These newly recruited nurses, they have been trained, trained under the exam conditions to pass the language test. Yeah. They have been focused to pass these tests. Whereas these nurses, they have been working in the English culture, adopting the language nuances, and they don't have enough money to go and undertake this language training. Mm-hmm. So they just pop in to do the language test, and then they don't get the required score. So what happened was, it was brought to our attention. When I say our attention, I have a colleague who works as a South Asian organ donor campaigner. So when she goes from one part of the country to the other, she heard these stories of these nurses, and she contacted the Nursing and Midwifery Council and said, why are you asking them to do these English language tests? They are British citizens. So then the Nursing and Midwifery Council said, where is the evidence for these particular nurses? Then she asked me to get into the picture, and that's how I got into the picture. So I put my research hat on, and then we undertook a research. It was quick and rapid research, because we had to present the data at the Nursing and Midwifery Roundtable. So we did a questionnaire survey, and it was just through the closed Facebook groups. We have a community, Kerala Nurses community, so around 7,000 nurses are in there. So we just put it in there, and within 2 weeks, we got 859 responses. Wow. Just in that Facebook group. So we understood it was tip of the iceberg, this cohort of nurses, and the most poignant of all was 13 of them were master's educated. Wow. It really upset me, because I was just thinking if it was my daughter finished her master's in UK and then working as a band 4 or band 3. So we presented this data at the Nursing and Midwifery Council. Following that, the council agreed there is a case for change, and they formed a group called the External Advisory Group. We sat for a number of sessions, made few recommendations. So in our research, we put forward certain recommendations, and one was to acknowledge the employer's reference for language proficiency for these candidates who have been in this country for the past 16, 17 years and working in an NHS, in a health and social care setting. So they took on board that recommendation, and the External Advisory Group put forward a public consultation, because it was a change in the policy, overseas nurse registration policy. And after 8 weeks of public consultation, the public agreed. There is a case for change. There's a need for the policy to change, to make it more easy, not easy, but we need to streamline the process for these nurses. And they agreed for the employers to provide a supplementary information regarding their language proficiency. NMC implemented that change on Feb 8th of this year, and since then 220 of these nurses whose life was like quite miserable, who suffered both mental and physical ill health because of their unregistered, unprofessional status. They got their PIN number.
Well, it sounds like, so you've been able to make a lot of great change, it sounds like, with this invisible nursing workforce. What do you envision as the next steps for utilizing and harnessing the expertise of this nursing workforce?
Right, a good question. And I'm happy to answer that because we are working on that. So some of the trusts are happy, they are already proactive, and they have formulated a process through which they can support these nurses who are unregistered at present, but they want to get registration through this. It is called SIF pathway, SIFE, supporting information from employers, SIFE or SIF pathway. So they are already. There are other trusts who's a bit reluctant. Where
do you think that reluctancy comes from?
One is they are saying they have worked as an unregistered practitioner, so they have not had any communication or language proficiency as a nurse, as a registered nurse. Then they are saying they did their training quite long back, so they don't have much of a skills and competence required for registration. And then they have to undertake a return to practice kind of a...
clinical skill assessment?
Yes, yeah. But to them, I would argue, my debate would be, these nurses are working as Band 3, Band 4 in a clinical context. They are dealing with multi-professionals. They are dealing with patients, patient carers, more than a Band 5. They are dealing with, they take the concerns of the patients to the registered nurses. There is communication happening. Regarding clinical skills, these nurses have to pass something called objective structured clinical examination. Most of the nursing students would know about this, the OSCEs. So these overseas nurses have to pass a 10-stationed OSCE, in which 75% of the communication skill is already assessed in these OSCEs. You can't do a wound dressing without communicating with the patient, can you?
Yeah, absolutely.
Yeah, and professional values are also assessed, as well as evidence-based practice is also assessed. So if you're giving a certificate, a past OSCE certificate to whoever is assessing you, it endorses that you have a good command of English language. You can perform these kind of clinical skills, which a UK graduate can do, a newly graduated nursing student can do. What more do you need? Plus, these nurses have been taught and examined in English in their home countries. Plus, they have done a computer-based test, which is a multiple choice questions, around 180 questions, about the NMC, Nursing and Midwifery Code, professional conduct, etc. So they are well versed about the nursing standards.
Yeah, absolutely.
So we are working with NHS England to make these trusts aware of these issues.
Okay. And I know, so there is a myth that streamlining the process for overseas nurses is going to somehow degrade the quality of the nursing care in the UK. How would you respond to that myth?
It stands as a myth because you are not diluting NMC nursing and midwifery standards. And just at the risk of repeating myself, these nurses are being assessed exactly like a UK nursing graduate. They have to demonstrate they are skilled in evidence-based practice. They have to demonstrate they are well versed with the Nursing and Midwifery Code of Practice, and that they can and practice according to the NMC, Nursing and Midwifery Code.
Yeah, and with that do you feel like there's different standards for different types of international nurses in terms of the perception of diluting the standard of care?
The thing is, a nursing graduate student, they are not assessed for their language proficiency. They are assessed for their communication skills, how they communicate with their patients, with the doctors, with the other colleagues, etc. They don't undertake a language proficiency test. Whereas you are asking, the Nursing and Midwifery Council is asking the overseas nurses go and take a language proficiency test in which they assess for the connective devices, the syntax, the grammar, cohesive devices. These are all in a language context. So if you are teaching a language, you need to require all these things. But if you need to communicate in a clinical context, you need to show compassion, you need to show empathy, and you need to know how you are going to break a bad news, how you are going to introduce yourself to a patient, how to do small talk, these kind of things. So that is not assessed by the language proficiency. So what you're taking is a kind of a double standard, one for UK graduate nurses, one for overseas nurses. If for UK graduates, they are assessed in the clinical context by somebody called the practice assessor, these employers. But for overseas nurse, some outside agency is assessing whether they can communicate safely in a clinical context.
Interesting. Well, and I also feel like from the clinical side, it's kind of its own language anyway. So a test might not always be able to capture the essence of how we might communicate as clinicians and within like a multidisciplinary team.
With this myth, what you just mentioned about the kind of a two-tier system, there is this myth that if you pass the English language test, that's it. You are going to be successful in your communication in the clinical context. No, I think we need to spend a few months at least to adopt to the cultural nuances of that clinical context. I remember when I came in 2001, I said to my ward manager, the patient expired. And she looked at me like I've said something Greek or Latin. And then she said, Dilla, you don't say patient expired. You say it's only the tablets and things like that which expire. Patients either pass away or... But when I did my training, expired was a more good language, polite language. We don't say passed away. So there's that difference. If a patient says, I want to spend a penny, I don't think a newly recruited nurse would be able to understand what the patient means. So these kind of idioms and phrases that we use, we need time to adjust to it.
Absolutely, because even like some of the drug names here are different, but it's the same drug. So if you're coming from somewhere that uses a different word for it, you might not necessarily understand the treatment plan right away, but after you've adjusted to like a clinical context, you will have a better understanding of just the clinical language, which is always just so different no matter where like you go.
And the accents.
Yes.
That's another can of worms, isn't it? I hated to pick up the phone when I came, when the phone rang, so I would quickly escape when I hear that phone. So my ward manager once caught me, and for one whole week she gave me that kind of a desk duty. So just to handle the phone calls.
Like get confident with it.
Yes. So that's the way you pick up the language proficiency, communication skill, not through language test. Yes, you need such linguistic gatekeeping for academic purposes, but when it come to clinical context, you need more than that. Also, the scores that I said about 7 and B for IELTS 7 and OET B, when you take those scores, it's quite high standard. I don't like to say high standard. There is something called the common European framework for reference for languages, the CEFR. So it's for the global languages, for all languages, for French, Spanish, or whatever it is. And across the 6 units, that's how the proficiency is assessed. So the score that the Nursing and Midwifery Council is asking for these overseas nurses is C1, which is proficient.
Yeah.
Whereas in the nursing and midwifery policy, it says any nurse who is asking to gain entry to the register should have a good or adequate command of the language, of English language.
Yeah.
But here you are asking for an overseas nurse to be proficient in the language, whilst in the policy it says it is required, only adequate.
Yeah.
So adequate has been equated to proficiency. So when you scrutinize those kind of policy issues, you question, isn't it? You question, why is that?
Yeah.
And that's another area that we are working on to bring it down. So instead of C1, it is B2.
Very cool. And I know there's a myth that the UK won't even hire international nurses. Is that something that is true, or will the NHS hire nurses that are from international countries?
Let's hope it stays as a myth, because at present the NHS is staying because of the overseas nurses. The nursing and midwifery registration data suggests that over last year, they had the highest amount of registrations, of which around 52,000 registrations, of which half of around 25,000 were UK graduates who got into these NMC registration. The other half, around 23, was from the overseas.
Oh, wow.
So if you say they are not recruiting,
let's hope it stays that way.
Yeah. So you have that high amount of number of overseas nurses in UK providing quality patient care to the...
Yeah.
Yeah.
So we just had a question come in from a student that I'm going to play.
How can we ensure fair recognition of the international workforce here in the UK as part of our NHS?
Two cardinal things. One, when a nurse comes overseas nurse comes over here, the nurse should have equal opportunities. One of equal opportunities for career progression or for further education, whatever the person requires. One of the recent surveys, University of Huddersfield, they did a survey and says the newly recruited nurses the overseas nurses don't have that kind of a career progression.
Yeah.
And that is one of their challenges. The other issue is about the racial discrimination. The language that we use to speak about these international nurses is very derogatory. So that's another issue. Third, they are sold a kind of a different picture of the NHS and UK life by the recruitment agencies. And it's only when they come over here, they understand that is not the reality.
Yeah.
Again, one more thing is when they come over here, we always say you have to integrate, the overseas nurse has to integrate to the host culture. I would say it is a two-way process.
Yeah.
We have to, when I say we, NHS has to understand, acknowledge the cultural richness this overseas nurse brings over, the different kind of perceptions these nurses bring over.
Well, and I feel like in healthcare we preach cultural competency because you have families that you're treating from all different places. So to not recognize the cultural richness that international nurses can bring seems kind of counterintuitive to the cultural competency that we preach as like a clinical skill.
Yeah. We always say again about orienting the new staff to our system, but we also, whoever is in place, they also needs orientation to this new staff.
Yeah.
Their expertise, their experiences, what they are bringing in, and only then you can harness their skills and expertise.
Yeah, absolutely.
You spoke about perceptions, wrong perceptions, and I think that's the biggest issue that we have to tackle. Even before you perceive an internationally educated nurse, you have certain dangerous assumptions in you.
Yeah,
One
like
of those
stereotypes.
dangerous assumptions is that these internationally educated nurses cannot speak good English.
Yeah.
They don't have such skills and training, proficiency or competency. And one of the other dangerous assumption again, I think, is we think the British way of nursing is the best.
Yeah.
So, and when you develop policies based on these dangerous assumptions instead of evidence, it can lead to systemic injustice. And one such as this unregistered practitioners, the invisible workforce.
Well, it sounds like, through your position in campaigning for that, you've made a lot of great change to hopefully work towards.
It was not
better.
One-man thing.
Yeah.
We had
a good team.
Yes, a good team. My colleague, as well as a few others, and NHS England, Health Education England, NMC themselves. And I think when you go and debate and negotiate with such a powerful regulatory agency, you have 7,800 registrants under this powerful regulatory body, and then you wonder how can they make mistakes, whether they make mistakes. And then you scrutinize, you interrogate the policy, and you find these, but they acknowledged and they worked with us, and for them, hats off to them.
Yeah, well, and hats off to you, because like I said, it sounds like your team, healthcare is all about teamwork, and it sounds like that's being put to the test as well in making change in healthcare to hopefully have a lot more nurses coming into the NHS with a lot of really great expertise and background as international nurses. So
I think it is not a sole solution bringing in overseas nurses. It is only a part of a solution. But when you bring an overseas nurse, you bring the nation's culture over to here. And we are moving towards a global kind of a healthcare, isn't it?
Absolutely, yeah.
So that will enrich British health and social care. Only enrich, I think.
Absolutely. Well, thank you so much, Dilla. I've very much enjoyed talking to you. And thank you for being a part of King's Conversations.
Thank you. Thank you, Megan. Thank you for the opportunity.